Jai Hind. युक्ताहारविहारस्य युक्तचेष्टस्य कर्मसु युक्तस्वप्नावबोधस्य योगो भवति दुःखः. Bhagavad Gita says that those who are temperate in eating and recreation, balanced in work, and regular in sleep can mitigate all the sorrows by practicing yoga. To acquire health and happiness, one needs to live a balanced life. Jai Hind everyone. Before I take the pleasure of introducing our guest speaker, please allow me to express my gratitude to our CEO, Dr. Sandhya Raj, Vice Chancellor, retired Major General G.K. Thaplial, and our beloved Principal, Dr. Abhay M. Sankare Gowda, and our entire technical group for their hard work in planning this guest lecture. And I'm excited to be here, an amazing lecture that we are going to have today. I myself, Dr. Guneri Devi, working as an assistant professor at Maharishi Aurobindo Subhathi College and Hospital of Naturopathy and Yogic Sciences, Swami Vivekananda Subhathi University, Meerut. Our guest speaker, who will give us lecture today on recent trends and advances in yoga therapy. He is an eminent academician and researcher in the field of yogic science. He completed his BNYS from SDM College of Naturopathy and Yogic Sciences Ujire under RGUHS Bangalore in the year of 2009. And then he completed his MD Clinical Yoga from the same institution in the year of 2015. He was a medical officer in the Government Nature Cure and Yoga Center, Puttur, before becoming Deputy Director for Naturopathy College at world-renowned Yoga Institute, S. Vyasa, deemed to be University, Bangalore. He has conducted several kinds of research in yoga in India as well as in Germany about cerebrovascular changes following yogic practices. And also, he has published several research articles in international journals. Recently, he is elected as a treasurer of Enigma Karnataka chapter, and currently he is working as an associate professor and in charge principal for Yenepoya Naturopathy and Yogic Sciences College and Hospital, Yenepoya, deemed to be University, Deranakate, Mangalore since 2022. Thank you, sir, for accepting our request. I welcome Dr. Puneeth Raghavendra for giving an amazing session today.
Yeah. Very good morning to all. Good morning to Guneri, as well to the others has been joined to the team. So without much delay in the wastage of the time, let me start with the directly going into the recent trends and advances in yoga, because till now we have been understood yoga means it is for the spirituals, and then for the sannyasis or the sages. That means very simple to understand, those who not having girlfriends or the wives, and they can become the sages so that they can be continue their life. So there was one rough imaginations for all. But anyhow, we have been scenario has been completely changed. Okay, so we'll come into directly into the slides then. Okay, we'll go for the. Yeah, hopefully you are seeing this right.
Yes, sir.
Okay,
It's
so
visible,
just
sir.
yeah. Yeah, sure. So we'll go ahead with the slides. Fine. So recent trends and advances in yoga therapy. So one of the beautiful concept we had to be understand, especially into the as a yoga background students, even the BNYS graduates and those who study the yoga studies. The reason because, as I mentioned earlier, till now, yoga therapy was meant for the only to the spirituality. So ultimate goal of yoga is to attain the samadhi. I can say that. That's what the Bhojavritti says. Yoga samadhi pum prakrityur viyogopahi yoga. The ultimate goal of yoga is to attain the samadhi and separation of Purusha and the Prakriti. So that is called as an yoga. That's what the older concepts has been there. So separations of the Purusha and Prakriti is nothing but the complete liberations. What we call mokshatva in the yoga or the kaivalya in the yoga. mokshatva in other Indian philosophies, or in Buddhism, what you can Mahanirvana. These all are the same words. Okay, so the words are the different but have the same meaning. So ultimately, the performance of yoga is done only for the liberations. But what is the reasons for the liberations? It's very simple. See, the person always in search of the happiness. I hope you all agree with, right? Even a student writing the exam only because of the getting the good marks. But why he want to get the good marks? To get a good job. So ultimately, why he want to get the good job? To get the good earning. Earning. When you have the good earning, automatically you will be the leading one happy life. So that is one more of the concept. But ultimately, happiness once again depends on the persons to person. I cannot say that everyone will be having the same happiness, right? I used to say the simple word. It's like it happened to me also. One day, one small girl, she was studying in 7th standard, a neighbor girl, she was coming next to my home. So she was coming with crying from the school one day. I asked, "Arey puta, kya hua? What happened?" She was crying. I got a 99 out of the 100 in the mathematics. Alright? Out of 100, you got the 99. For that, why you are crying? No, I was expecting up to the 100. Alright, it is very funny part, because I thought that 99 would be sufficient for the three boys to pass, because about 30, in BNYS, out of as per the regulations, you should have 40% passage criteria in the theory. That means you should get above 32, right? So that is a, if you divide 99 by 3 means 33 it will come anyhow. So this is called as happiness, right? So this was the concept has been brought for the practice of the yoga. So in order to gain the happiness, so what is the reasons for the gaining of the happiness is because human beings were the santosha dhanuttama sukhalabha, what we can say that the sukhalabha is was expected from the every individual. So gain that sukha, he thought, if I take the rebirth as a human beings, so if I take the rebirth as a or any other animals, I have to lead the life. That means once again there will be merging of the Purusha and the Prakriti. Right? So they brought the one more concept of here. Let us go out of the bondage of the cycle of the birth and death. So you'll be going out. When you go out, automatically there will be no chance for the rebirth, right? When you won't take the rebirth, automatically there will not be any sadness or any miseries in the life. This is like what happens in the examinations, right? Most of the students, they will be thinking about the failures in the exam. So what they do automatically, okay, I don't want to fail, so what I will do, I will not write the exams itself. सिंपल अगर एग्जाम लिखे तो भी पास होता है ना तो मैं क्या करता हूँ आई विल नॉट राइट द एग्जाम इटसेल्फ फिनिश ओके so this was the concepts of the Indian philosophies to be come out of the misery you to have to come out of the all kind of the sadness so they introduced yoga they said that okay if you go for attain the mokshatva there is no any rebirth so you can come out of that okay but how to attain that mokshatva they are finding the various solutions for that. They found karma yoga, jnana yoga, bhakti yoga, and later there's all the other signs of emotional cultures, right? Because they are the bhavana yoga under the streams of yoga what we have been studying. But the bhavana yoga it was difficult for the people to accept also. But ultimately, the reason that there should be one simplest form, right? The easiest method to achieve that. This is like in earlier time when you wanted to prepare the any dosa or idli, the fermented idli. What you used to do, you'll prepare the batter at the overnight. You'll prepare it overnight, then you prepare it the next day morning. But the people is not having the patience for that. What he will do, the next day morning immediately he'll get it from the fridge also. Means that right now we get the batter which has been stored, prepared, ready-made prepared. Still more people are lazy to prepare that batter. They have another option. They can order in the Zomato. Okay. So these are the kind of the mindset of the people. They will not be able to concentrate on any specific part, on the specific consciousness. Okay. So they introduced some other techniques. They found the asana. So that's the reason Hatha Yoga said asana is the first limba. Whereas the kriyas, so that's what Gyana Samhita says that kriyas are the first limba. Mm. Patanjali said the Yamaniyamas are the first limb, but the people found difficult to follow the Yamaniyamas. They found asana as a pranayama as one of the best techniques. When they finding that, they found the best of the result of that. Okay. So what are the result? When you perform any specific practices, so they will give the desired physical fitness because Shariram Adhyam Kalu Dharma Sadhanam. Sharira is a very important. It is a tool. You can say that one of the tool to Dharma Sadhana for any kind of physical activities. I can make it the simple way to understand. It's like electricity. What is the purpose of the electricity? If the electricity is there, so let me take it in this way. You want to get one cool air, cool breeze. There is an electricity, but if the electricity just it is there, you won't get the cool air, right? You want one fan or AC for that. So that's how AC become one of the tool for you. So like that way, but that tool will be controlled by that of electricity. That is how our body as well as our mind. So our mind is an electricity. But whatever you happens in the mind, that will you cannot directly exhibit. So you need one physical body. Okay. So that's how the Sharira Madhyam Kalu Dharma Sadhanam. That should be the Sharira should be the fitness. So that's how it is brought physical fitness also by that of the yoga. There are some mental status also. That's why the oldest text says about the evolutions of the yoga therapy. I can say with the Mana Prashamana Upaya Yoga Ityabhidiyate. Yoga is a skillful trick to calm down the mind because yoga has a 5 level development. They are physical, mental, social, intellectual, as well as spiritual. You can take the emotional also. Okay, even. So these 5 sheath development are the very, very important. So when you perform the yoga, the physical fitness also be very fine, right? Suppose you can take it like an example of the preparations of the food for the longer duration. If your mixie is working for the 10 years, then only you can prepare the very best of the food, right? If the mixie is not working very well, so what do you have to do? You change the mixie in the market, but you can't change your physical body like that very easily, right? So that is the reason physical fitness is also important. The social, the mental, emotional, spiritual, these all climbs to get the focused into the practice of the yoga therapy. So we can say that origin of the yoga therapy when it has been started, right? So yoga has been started. Hiranyagarbha yogasya vakta na anya puratana. Okay, Yajnavalkya Smriti says. Hiranyavalka, sorry, the Hiranyagarbha. Who is the Hiranyagarbha? Lord Surya is the Hiranyagarbha. So you all would have been chanting the starting prayer for the Surya Namaskara, right? Hiranmayena patrena satyasyapi hitamukam. Okay, so Aditya or the Surya or the Hiranyagarbha is the first person. Okay, but from him the yoga has been evolved. Okay. Then we have been checking into the one of the oldest Upanishads. I found the best of the reference here to get the origin of the yoga therapy. Why I take this as a yoga therapy? Because when there is a desired result, then only you will apply for the management as a therapy, right? If there is no desired result, they won't apply. So that is said, it is very clear here. Lagutvam, Arogyam, Alolupatvam, Varna Prasadaha, Swarasaushtavam cha, Gandha Shubho Mutra Purisham Alpam Yoga Pravrittim Prathamam Vadanti. So lightness and the healthiness of the body, absence of the desire, alolupaptvam. Desires will be reduced. Clear complexions, varna prasadaha. Okay. I hope this clear complexion you would have been learned very well in the our naturopathic diagnostics, right? What is the skin color should be? It should not be too pale, should not be yellowish, should not be bluish, right? So that is a varna prasadaha. As well, swara saushthavam. Swara also should be the swara, pleasantness of the voice. Because when you have a very pleasant voice, you can say that you are the healthy, fit, and the very well. As well, gandha shubho. They will get the pleasant smell of the physical body. Mutra purisham alpam. Any kind of the secretions from the body, there will not be over secretion. That will be the with limit. You know that the overperspiration is also one of the symptoms of the stress, right? That's why it is they said the mutra purisham alpam yoga pravrittim pratamam vadanti. It has been said by performing of the yoga you get all this result. This has been explained in 400 BC, okay, in the Shvetashvatar Upanishad. Roughly the same thing has been taken next into the when you go for the hatha yoga practices, okay. So Hatha Yoga also says to the same thing. It's like the Vapukrushatvam, Vadane Prasannata, Nadasputatvam, Nainasu Nirmale, Arogata, Bindujaya, Nadivishuddhi, Hatha Siddhi Lakshana. Right? So that's what we are applying into the yoga therapy. So let us go for understanding the few complexes, the recent trends. So one recent trend is what you can say that mind body medicine. Okay, so mind body medicine is nothing but a holistic approach. We always think about what I mean by holistic approach, right? Holistic approach means a comprehensive techniques. The everything will be combined together. Ultimately, the result is good. It may be you are writing, for example, all are the students of the anatomy. Let's take it in this way, referring into the circle of Willis, one of the trickiest topic, right? So, how we will learning this circle of Willis? Circle of Willis, first you will sit open a textbook first. So Chaurasi you will be open. After referring that, you will get confused. You will check with the faculties. Still you will get confused. You will discuss with the student. Then you will watch some of the video because right now YouTube is easily available. So this is a holistic approach. Ultimately, result should be the same. That's all. So this is recognizing connections between the mind, body, and spirit is maintaining the health and the well-being, the complete well-being. So the mind also should be the very, very important, right? So that is how our yoga sutra said about yoga chitta vritti nirodha. Because if you take only that sloka, one sutra, it has a huge meaning into the connections into the physical body, into the mental body. Because what do you mean by chitta? Chitti chitta, that which makes you to think. Whether a knife can be used to cut the vegetable or to kill a person, who will decide? Your chitta will decide that, right? So there is reason mind-body medicine acts as a major role in the yoga for the management of the all kind of the diseases. So let us make in continuity here. So there are the 4 phases what you can get in cause of the diseases that will be derived from the mind, right? So that's why it is said as a psychic phase. This is like, I can say among you, the student, when there is a, suppose, let me make it in simple ways. Once you wake up in the morning, you woke up at, suppose you are supposed to wake at 5 o'clock because the Brahma Muhurta Uttishta is very important, but you will wake up at 7 o'clock. But on that day, when you woke up, you had a mild headache. You'll feel quite lazy to go to the college. Okay, so what you will do? Oh, you have the headache. Seeing that one day, okay, I will take a break. Okay, so day after tomorrow, you have the internals or the university exam, final university exam. Even though you have the severe headache, you are a part of your head is broken. Also, you will come to the college. Correct. So at that time, the pain or the whatever the scenario, the thoughts, they will not be disturbed you. Correct. So that's why the individual perception is there. So that's why chitta is a very important. Chitta makes you to think whether you are doing right or wrong. You can ask with your faculties only. Most of the faculties, even though I can say myself also, we all have come from the college background only. During the college days, we will be taking leaves for 5 days also we would have been taken. But after joining the duty, even though we have the fever, we will come to the hospital, see the patient because that is a dedication. At that time, the mind fever will not be a major issue for us. So chitta makes you to be desired that whether it's right or wrong. So that is the reason. First phase is a psychic phase. Psychic phase is marked by the mild with the persistent psychological as well the behavioral symptoms. They are like the stress, like the irritability, disturbed sleep as well. These phases are related to the Vijnanamaya and the Manomaya kosha. Okay, why these two are the important on the Vijnanamaya and the Manomaya kosha? The reason because the pain what you have today in the because of the headache, if you won't go to the college, you will not be able to write the final exam. right? So that will be taught in a Vijnanamaya, the state of intellectual stability. That will makes you to know today's internal exam, you can maintain that, you can bear that headache so that you can attend the classes. You can write the exams. So that will be taught in the Vijnanamaya portions. So that is in the first stage of the psychic phase. So here, mind-body therapy is a very effective in this phase, right? What do you do? The physical practices will make you to the mind to be strength. No, okay, I have the mild headache, not an issue. I will give the, take one few acupuncture, the press needles where I can press, keep on pressing the ego. That would be sufficient for me. The headache will be reduced. I can go ahead. So this is what in the psychic phase is the earlier. As the next step is the psychosomatic phase. So here the psychological complaints of the psychic phase, they will be converted into the psychosomatic. Okay. So what is the psychosomatic? The psychic will be converted into the psychosomatic. What happens in the psychic? So there will be lowered sleep. Lowered sleep that will be leading into the indigestion. There may be the constipation. Okay. Being in constipation, you should be aware of that. This is the month of December, constipation awareness month. Naturopathy also says that constipation is a mother of the diseases. And they are the recent study, they have been, I said, I read almost a week before, regular use of the calcium channel blockers among the hypertensives, they will be leading into the constipation. These leaded constipation, there will be the worsening the conditions of the hypertension, and they may be the reasons for the cardiac arrest. Okay, so that is one of the studies as an naturopathy students you can take in the future. So this is a psychosomatic phase. Whatever they are in the psychic, they are converted into the psychosomatic now. They are reflected in your physical body. Okay, so that's how it has been worked in the pranamaya koshas level as well. Next into the completely the somatic. So the psychic will be reflected completely into the somatic phase. There will be in the Annamaya Kosha, there is a changes, right? There will be the diseased status. You'll be feeling unstable, the diabetes or the obesity or thyrotoxicosis, what you can see, or even the gout. These all are the somatic phases because of the thoughts they are in the mental status. So ultimately, at last, you are going into the organic phases. In the organic phases, the full manifestations of the disease state. Okay, they are the chronic hypertension, chronic kidney disorders, as well uh, the hypertensions. Okay, hypothyroidism, even up to the hyperthyroidism. So these all are the completely what you can see in the organic phase. So yoga therapy is a palliative and a quality life improving effective in this phase. So if you begin from this state itself, you have to treat that treatment even from the Vijnanamaya Kosha level. Let me take one simple example for you. I was studying my MD period in the second year MD at the Dharwad. Okay, so we were working in the department of the medicine. When I was sitting there, Dr. Jaishankar was he was a retired professor from the KIMS Karnataka. Okay, so he was retired from there. Okay, KIMS Hubli, I guess. So somewhere he is from there. So he was sitting along with me. He was 70 years plus at that time. So sorry, 60 plus at that time. That's it. So we were the student along with him. One lady, a village lady, came there. She was saying about the I have the constipation. Sorry, the headache. I simply said, you drink sufficient water, more than 3 liters of the water per day. Okay, so after 2 weeks she came back. I asked how is her headache. She said headache reduced. So Jaishankar sir, he got a shock. Arey Puneeth, what is this such a therapies you are using? Just drink by the water. How the headache will be reduced? I said, sir, when she came, she was looking very pale. She was very dry, and then she was dehydrated. So her body water levels were the lesser. Body water concentrations were the lesser. When we have taken sufficient water, automatically what happens that enhances the circulations. The eliminations will be enhanced that have reduced the headache. That's all. Okay, so this was the you can treating from the Vijnanamaya Kosha level because it is important for you to make the patient to drink the water, right, throughout the phase. So that is into the organic phase. So I hope till now you have been cleared here how in the mind body medicine affects in the various phases. Okay, so next I'm going to the yoga and the pain, how this pain can be reduced. So Practice of yoga, this helps to the decrease in the perception through the cognitive disengagement, mainly the pain perceptions. Okay, disengagement. This will be leading into the decreases in the affective aspects of the pain sensitivity and increasing of the interoceptions. Interoceptions is nothing but the internal signals, correct? The responses to the internal signals. What are the internal signals responses? It's like when you're feeling thirst, you have to go and drink the water. Right? When you're feeling hungry, you'll go for the eating the food. When you're feeling tired, you will go for the sleep. So these are the interoceptions. Okay. So pain tolerance is increased and the anxiety that is associated with the pain, there will be decreased to the reducing the hyperarousal of the HPA axis. So HPA axis I will explain into the next slide actually, hypothalamic pituitary axis. So there will be reducing the output of the stress hormones. So this occurs to the interactions with the brain structures that support the perceptions of the stress. As well, support the mood, cognitive ability, as well including the amygdala, insulin and the hippocampus. So these are the states of life. As well, we have to understand one more recent advances is like see, yoga is a multimodality practice. So what I mean by multimodality practice, there is no any specific, only the asana practices. There are the relaxation techniques, there are the pranayama, there are the meditation, there are the shakriyas, the cleansing techniques. As well, you also have the practice of the yama niyamas. Right? These are also plays a very major role there. So these are the on the bidirectional interactions, they have the impact on the physiological and the emotional health. They're controlling the peripheral inflammatory responses. They are involved in the pain signaling. Yoga helps to the regulating the nervous system by the hyperarousal through the HPA axis. They'll be increasing the parasympathetic activation through the vagal nerve complexes and the reduces the allostatic load to help the stabilize the autonomic nervous system. So this improvement of the vagal tone is closely linked to the yoga help to control the inflammatory responses of the adrenergic reactions to the chronic anxiety. They are providing the potential mitigation of the detrimental feedback loop of the stress and the pain. So this is how yoga will be helpful for. Okay. Desensitization, one thing you can say that. Let us take another way. In connections to the what we can call into the asana, right? So in asana it has been said very clearly, Prayatna Shaitilyam Ananta Samapatibhyam. What do you mean by the Ananta Samapatibhyam? Ananta Samapati means endless state. What is the endless state? So it will not be given for the any pain reflexes for you. Prayatna Shaitilya. Regular of the practice, they go for the acclimatizations of your physical body into that pain. So that's what it is said here. Okay. So while you're practicing the Padmasana, first day. Okay, let's talk about the Padmasana. Sukhasana. When you join to the first year BNYS, when you sit in the Sukhasana for more than 5 minutes, automatically back pains, low back hurts, कमर दर्द हो रहा है, सीधा बैठ नहीं सकते हैं. These are the घुटनों का दर्द. This are all common for you, right? But as you continued in the practice, you are sitting for the prayer for the longer duration. So what is the result at last? Automatically they will be the reduced, right? So they will be completely reduced for you. That is the acclimatizations. So that's how the body mind medicines are working there. Your mind says that the pain will not be अरे कुछ नहीं हो रहा, it will be reducing, it will be reducing, fine. So as you continue that, so that is to the person, the cognitive disengagement means the same thing. Even the pain persists, you will not go for the responses for it. So like how the mind body medicines also, when the pain aggravates, when you more respond for that, right? When you more of the responsive to support to your situation, that will be worsening the condition. This is how the yoga will be working on the mind body medicine. And the pain tolerance is, as I mentioned before, associated with the decreased through the reducing the hyperarousal of the HPA axis, thus reducing the output of the stress hormones through the interactions with the brain structures in support of the perceptual stress and support mood and cognitive abilities, including the amygdala, insulin, and the hippocampus. So next I'm entering into the psychoneuroimmunology. One more thing I told to Guneri also, this topic what you have been taken is quite huge. So most probably in the future days we can have some of the smaller topics so that we can understand very in detail. We can take the psychoneuroimmunology only into the pranayama, or we can plan about psychoneuroimmunology only into the asana. Because what happens? So if we take only the word as yoga, it is a too huge. Correct? Because yoga has a various subsectors in that. That's why Maharishi Patanjali easily, he made it in the year 2000 years before itself. Yoga means that it should be 8-step practices. Yama, Niyama, Asana, Pranayama, Pratyahara, Dana, Dhyana, Samadhi. He has completely divided it. But when we are studying now, we are combining yoga together. So that's what it will, we are feeling quite difficulty to go in detail. Right? So here in psychoneuroimmunology, so what do you mean by psychoneuroimmunology? So they are the new field study that looks into the interactions between the central nervous system and the immune system. The easy way to understand psychoneuroimmunology is nothing but when you're feeling unhealthy. Sorry, let's take it in this way. When there is a exams, the final exams has been announced, and throughout the year you have been not studied. Though there are only the 3 to 5 days has been left. All right. So immediately we'll start studying day and night. Day and night we'll start studying with the stress. What is the stress? If I won't get the good marks, what happens? My parents will scold. Okay. My friends will laugh at me. Okay. My all friends makes fun on me. मजाक उड़ाते हैं अच्छा ये पूरा साल भर टाइम पास किया पूरा पढ़ाया नहीं so they will be think at last, right? So that will be automatically what happens day before the exam you had the fever. Throughout the year you did not have any complaint, no fever, no constipation, no sinusitis, nothing you had. But exactly day before of the exam you have the severe fever and you can't sit and I can't concentrate. The reason because when you take the stress here, the immune systems are compromised, that is reduced, okay, that will be resulting in the diseases. So that is called as psychoneuroimmunology. So yoga is designed to optimize an individual's psychoneuroimmunological functions by addressing the root of the negative and unconscious conditioning as well, prescribing the multidimensional practice for the positive transformation. So what and all you have to do here, you have to strengthen the immunity, you have to go for asana also, you have to go for pranayama also, you also have for the cleansing techniques also as well meditations. So that's how we are the psychoimmunology, it will be normalizing. So the PNI mechanism, there is interactions between the brain and the immune system. There are the initiator, mediator, as well the target. What are the initiator? You can call it as your exams are the initiator. The stress is an initiator. Okay. Suppose you're not able to study well, unable to concentrate, familial some problems. These all are the initiators. Mediators are the corticosteroids and the hormones, right? The stress hormone. Okay, these all are the mediators and the targets. Targets are your immune system mainly. Okay, mast cells as well the macrophages as well the interleukins. So these all are the target cells. Okay, let us go understand the PNA quite in detail. Okay, one of the beautiful topic for you to know here. So what happens here? There is the people we all currently live in sympathetic overdrive. What do you mean the sympathetic overdrive we are living? Everything should be fast and furious. Correct? Immediately should be acting. Before and all, when we started the mobile, we were doing in the 2G. If you click on any one picture, it will rotate, and it will take to open that picture for the half an hour. Sorry, it may be up to the half an hour it used to be open also if the signal is weak. But right now it is we have it in 5G. Once you just single click, it should open. So that is an overdrive, high speed, high fast. Everything should be the overactive. But because of this, due to continued this kind of the excitation, what you will do? Keep on push it. Correct? You read. See, when you are there in the home, they will say that you study. Even from the first standard, you would have been seen. Correct? So what do you have to do? You have to push, 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 push. These kind of the over excitation, they will be the major neuroendocrine system. They are be the reasons for the HPA axis regulations. Okay. So when these HPA axis are the regulated, they are the reasons for the release of the CRF. They are the corticotrophic releasing factors from the hypothalamus. These will be stimulating the release of the adrenocorticotropic hormone ACTH. Okay, they are subsequently stimulate the adrenal cortex to produce the and to release the cortisol. This cortisol is there, no? There is one of the cunning fellow. We always think they are the very good. They are the stimulant, correct? Like how our gobi manchuri, right? We always think, alright, gobi manchuri is very tasty. If you eat the regular food, there will not be any specific taste. If you eat the gobi manchuri, I always say that the gobi manchuri is a rajasika ahar, one of the best example. Kattu amla lavana atyushna tiksha ruksha vidahinaha ahara rajasa shrestha dukkha shoka amaya prada. This is what the Bhagavad Gita says about the rajasika ahara, right? Would have been learned well. Okay, so this food makes you to be stimulant much. So these kind of the longer response of the cortisol, they will be leading into the metabolisms of the aiding into the metabolism of the fat, proteins, carbohydrates, in converting them into the glucose through the gluconeogenesis. And these longer time of the stress will be rises in the blood glucose level, suppresses the immune system, causes retention of the sodium and the water in water by the kidneys, increased in the blood volume of the blood pressure. So on the long term, what happens? That will be resulting in that of the diseases. What you can see here, see the release of the macrophages, NK cells, T cells. These all the suppressed at last, right? Anti-inflammatories has to be increased now. Okay, so this is how the psychoneuroimmunology results for the diseases. Understand it. Now, let us think about how yoga will be helpful. Yoga improves the vagal tone mainly. Okay, parasympathetic dominance will be there. There will be include vagal tone by reflect by the increased heart rate HRVs. So that has been the one of the reasons. Increase of the parasympathetic activity. Most of the paper you would have been seen parasympathetic calming down, calming down, calming down, right? In the relaxation techniques also you would have been seen relax, calm down the mind, calm down the mind. So that is a very must as well. Promote the release of the prolactin and the hormone oxytocin. This is one of the beautiful impact on that for normalizing the body as well. Reduce the circulating levels of the cortisol. So what you have been understood now, cortisol has to be reduced. So automatically you will be reduce the cortisols. Correct? When the cortisol is reduced, so that will be normalizing the body mechanism. Correct? So this is how to be helpful. So this is the yoga practices on the management of psychoneuroimmunology. Then what I'm taking into the neurotransmitters. So neurotransmitters, they increase the multiple neurotransmitters and the hormones such as the GABA, cytolin, and the dopamines. So increased in the levels of the melatonin, they will be helping into the initiate the sleep, improving the sleep and the quality of the regulations. So increasing levels of the oxytocin. So oxytocins, they are the bonding hormones. Okay, bonding hormone. What do you mean by the bonding hormones? So bonding hormones are they will be giving you the good bondage, good happiness. This all will be brought it, right? So that is how in the morning itself. Just I mentioned about the also the same thing. There are the chitta prasadana as a chitta vikshepas, correct? Chitta vikshepas, they are the wavering the mind. That's what we think thought about in previous in the psychoneuroimmunology. व्याधिस्त्यान संशय प्रमादालस्य आवर्ति भ्रांति दर्शन लब्ध भूमिकत्व अनवस्थितत्व चित्त विक्षेपास्ते अंतरायाः as well दुःख धर्मनस्य अंगमे जत श्वास प्रश्वास. So these all are the antarayas are the reasons for the exciting over excitations of the hormones, correct? So they will be reduced by that of the practice of the chitta prasadana. Maitri, Karuna, Mudita, Upekshana, Sukha Dukha Punya Punya Vishayana, Bhavanata, Chitta prasadana. So that when you practice the yoga, they will bring the happiness with one another. Correct? So they will be the in helpful for increase of the oxytocins. So when the oxytocins are increased, that increases the bonding hormone. So the you can see the connections with the as a being seen and being heard. This all can be, you can see. So the GABA is one of the what is chief inhibitory neurotransmitter. So they will be working to reduce the neuronal excitability as an activity throughout the central nervous system. So this GABA acts as an important player for the body's responses. They are the stress, as a fear, as a depression, even in the anxiety. So lower than the lower levels of the GABA in the brain, they have been associated with the schizophrenia, depressions, anxiety, even with the sleep disorders. Okay, so this will be helpful. This is how the yoga as well your meditations they will be helpful in this way. And ultimately yoga and the inflammation. I think I don't need to take it in much more of here because I mentioned here how the yoga will be helpful in the okay. So decreases of the inflammatory markers such as the CRPs, C-reactive proteins and other inflammatory cytokines and increasing the levels of the multiple immunoglobulins and the natural killer cells. So recent studies they have also shown that the practice of the yoga regular have the higher levels of the leptin and the adiponectins in their bodies. Okay, higher of the leptins and the adiponectins. So they will be helpful in the management of the various new kinds of the diseases. So both the natural chemicals they work to the elevate the inflammations in the body. And ultimately, let us go with oxidative stress. One more recent advances. Okay. So what do you mean by oxidative stressors? Oxidative stress is a mechanism where negatively charged ions are produced within the body. These negatives are called as a free radicals. So these free radicals are the negative in action. They will keep on destroying the cells. So we will in order to reduce that free radicals, what we use will be taking one antioxidant. You supply one molecules of the oxygen. Let us take the H2O is one molecules. From H2O, you take OH minus and one O. Okay. So sorry, OH minus and plus one H. So there is one hydrogen molecules. Right. To that, you supply one more oxygen molecules. So automatically what happens that will be neutralized. Then they will not be negatively charged, right? So there is a presence of one OH minus, one negatively charged ions. So they will be what happens, they will keep on destroying. So what do? You supply one more molecules there. So automatically they will be normalizing then. This is how you have to the pranayama plays a major role here, supply of the antioxidants. Let us take it in this way, the easiest ways to understand. See what you do in Kumbhaka. So Kumbhakas are the four types. Kumbhakam Trivide Bhoktaha, Trivide Uktaha. So they are the Antar Kumbhaka, Bahir Kumbhaka, as well the Kebal Kumbhaka. Right? Antar Kumbhaka, Bahir Kumbhaka, and the Kevala Kumbhaka. Okay. So beyond that, there will be the one more Kumbhaka. They are the Sahaja Kumbhaka. Sahaja Kumbhaka is nothing but the internal retention without any effort. Okay, you forget it. Let us take the simple Antar Kumbhaka. You take one example is here. What happens in the Antarnal Kumbhaka? You will be withheld the oxygen within. You are holding the breath. What happens once you holding the breath? Automatically, the gaseous exchange increases. Hope you know this mechanism, right? There's a difference between ventilation and respiration. In respiration, only the air goes inside. There's a gaseous exchange. In ventilation, there is no any gaseous exchange. Right? So what happens here when you go for the Antar Kumbhaka? You may have heard about the Bohr's effect in physiology, right? Partial pressure of the oxygen should be indirectly, inversely proportional to the partial pressure of the carbon dioxide when it is the associating with the ferrous oxide. So that is the Bohr's effect. So what happens here when you withheld the oxygen within, not only oxygen, complete air, partial pressure of the oxygens will be high as well partial pressures of the carbon dioxide will be the less. That means you are supplying the maximum oxygens to the body. What is the importance of the antioxidants here? To the longevity, the long time. When we supply the maximum oxygens to the body, we live long. Skin will be disease free. Okay, so you would have been heard in the shlokas like in Hataya Pradipika, no? Valita, Palita will be reduced, right? Valita, Palita, the tremors will be reduced, the dryness in the skin will be reduced, hair will not become the whitish at the earliest, right? That will be supply of the antioxidants to the body. And this has been explained in Hatha Yoga also, right? Yavadva yusthito dehe tavad jivan mushyate. तावज्जीवन मुच्यते मरणम तस्य निष्क्रांतः ततो वायु निरोधये. That is the reason you hold the breath within you, hold the air within you. Okay, so they are supply of the oxygens to the body. And the cause for the diabetes, the cause for the hypertensions, these all are the, even maybe the atherosclerosis, they are all due to the free radicals, and easily you are reducing the free radicals by the practice of the yoga. So that's why pranayama has to be practiced, and in the longer duration it should be practiced. Okay, longer ways it has to be practiced. Even the practices, that's why Hatha Yoga says it's like प्रातः मध्यदिने सायं अर्धरात्रे च कुंभकां शनै अशीति पर्यन्तं चतुर्वारं समभ्यसेत्. प्रातः अर्ली मॉर्निंग, मध्यदिने midday, सायं end of the day as a madhyaratri. Midnight you have to practice. Midnight is, don't think, oh, I have to wake up at 12 o'clock like that way. So midnight, the whole 24 hours will be divided into the four sectors. That means every 6 hours you have to go for the practices, right? That will give you the excellent result. Okay, that's what the half life. How you have in the paracetamol's half life is for the 8 hours. So like that way. So this also will have it is with the half life of the pranayama. That's why they suggested per day 4 times. Okay, and the duration. What is the quantity? Okay, what is the quantity? How in the modern drugs will do the quantity like that? A pranayama quantity is also is there. Shani ashiti paryantam. 80 rounds you have to practice at a time. That means 320 repetitions you have to go for the pranayama part. That gives you an excellent result. I will give the one live example with this way. When I was working in SVSA, there was a patient. She came with the gastritis. She was dependent on the pantoprazole 1 BD. Okay, every day morning at morning, once and the evening. And I told her to go for the practice of pranayama only Shitali. Okay, only Shitali, and she was taking pantoprazole since 12 years almost. Okay, so I told her to go for the practice of Shitali pranayama, nothing else, only the Shitali per day 5 times, and one repetition, 50 rounds she has to go. So per day she has practiced up to the 5 into 15 is 250 rounds. I met her on Friday on the day of consultation, but I did not go on Saturday. Sunday was a break. I met her on the Monday, and I did not stop the medication there. She went along with the medications. So I asked, how are you feeling? She said, almost 70% of symptom has been reduced. Okay. So when it has reduced 70%, so I made it very clear, it has been boosted the impact of the pantoprazole. That's all. I won't say only the Shitali would have been reduced this much. Never take that decisions. Okay. That's what we said at the first itself, the holistic approach. You give the medicines, along with that you can go for the pranayama. That will be the ultimate result, because as a physician I say, at the end of the day, it does not mean whichever system you practice, your main goal is getting the good relief to the patient. So that's why always I say, who is the best physician? He is not only the treating the patient, who is also find the best medicine, by which system of the medicine he will get the best result. He is only the best physicians. Okay, that's what we have to implement. So this is how moleculars also will be helpful for. So ultimately, one thing you have been understood, yoga is to flex the mind, not the body. Forget it. If I practice asana, that is sufficient. If I practice the pranayama, that is sufficient. No, right? I'll give you one more example in this way. When I started my clinical practices, there was a patient early diagnosed with the diabetes. I suggested her for the yoga practices as also go for the no coal juice in the empty stomach. She was taking under medication. She was under medicines for the 6 months. I stopped it. Within 6 months, she has stopped it. we can say that she was, I cannot say non-diabetic, because diabetic under conventional alternative medicine, she was better controlled. But after 8 months, the sugar shooted up. I asked why. She said some of the bad incidents happened in the family. Okay, her grandson passed away, so that made us to be stressed up. So automatically there has been increased. Correct. So this what you have to understand. Once you control the mind, then only automatically will control everything under control. Or else simply we'll say that okay, I practice the pranayama, I practice the yoga, I'll go for the vakrasana. So that if I regularly practice the Yavakras, there is one concept is what you can twisting abdomen, there will be the squeezing the pancreas, so that islets of the Langerhans will be stimulated, so the insulin will be produced. So only by twisting you can control the diabetes, right? It cannot possible. You have to control your mind also. When you control in this way, that will give you the very best result. With this, I will end up here with my sessions. Actually, I took 10 minutes more. Hope you have been went on with very well. Shubhamastu and Jai Hind.
Jai Hind, one and all, once again. I would like to thank our guest speaker, Dr. Puneeth Raghavendra, sir, for this enlightened session. It was an amazing session, sir, and thank you for sharing this knowledge related with the philosophy and the scientific evidence. And also, I would like to thank our CEO, Dr. Saldya Raj, Vice Chancellor, retired Major General Dr. G.K. Thaplial, and our beloved Principal, Dr. Abhay M. Sankrai Gowda, staff members, students, participants, technical groups, and last but not the least, our beloved audience for making this session as a grand success. Once again, I thank one and all present here. Thank you
Yeah,
so much, sir.
just
Thank you so much, sir.
before I end, Guneri, I would also like to thankful for the Dr. Abhay sir, and he was my teacher for the studying the PNC. 1 year he has taken PNC for me in the in SDM. So what I am existing now here because of him. So I become the teacher because of his teachings at that time. So my current existence is because of the him only. So Guru Bhyo Namaha. So thank you to one and all. Namaste.
Thank you so much, sir. Jai Hind, one and
Yeah.
all. Thank you.